the pain that you're having on your knee, so kind of on the top sometimes, but then also towards the side, that pain usually comes from referral pain. So most times actually in the body, when you get pain, it's not right where you should be working. And this is very confusing for a lot of people, which is why they get massages and start stretching things and they don't see any results. That's because you have something called referral pain. In your instance, there is a muscle, that teardrop shaped muscle that's here, right? So it's here, right? That muscle attaches to your knee. So it's part of the quad because the quad has 4 different muscles, right? Quad being 4. The quad has 4 different muscles, right? And that teardrop muscle here, this kind of keeps your knee stable. It's a part of a knee stabilizer. And what happens sometimes, that muscle just gets super tight or maybe even like dry because a lot of blood flow isn't coming to that area. So the point in doing the massage and the foam rolling is to get some hydration and some blood flow in that area, because in your blood you have the nutrients that actually hydrate that muscle. And also you have all sorts of ligaments and tendons in here. Now, if you massage ligaments or tendons, it's not gonna do anything because ligaments and tendons don't have a blood flow. So you can't really push blood flow into a ligament or a tendon. You would do that by exercising. So when you're walking, when you're squatting, when you're doing movements, that's gonna push blood flow into an area. So in order to get rid of the pain that you have, we want to force some blood flow into the area, but also we want to relieve the tension and tightness that's probably going to be in this teardrop shaped muscle. So how you do that is a couple different things. If you have a foam roller, you're basically going to be laying on the ground with it like this, right? So you're laying down, the leg that you're working on is going to be bent, and then you're here, right? What I like to do is just roll. So I'm letting my whole body weight sink into the foam roller. I'm rolling to find a spot. Once you find a spot that's tender, you just hold it there. What you can do is kind of move this leg up and down to give a little bit more pressure into the foam roller, right? If you need more pressure. If you don't need more pressure, that's fine. You might notice that that area feels really sharp and tight, right? And that's completely normal, but that's what you want to get rid of, because that sharpness and that tightness is going to lead to that referral pain that's happening in your knee, right? Another way that you could actually get to that same area is a massage just like this. I find that when I do that, my hands just end up getting a little bit sore. So what I like to do is use my elbow. Now, I like to use the same side elbow. So if it's my right knee, I'm gonna use my right elbow and I'm just literally laying my body weight into that area. So again, I'm starting on that teardrop shaped muscle, right? That's coming up a little bit, like maybe 1/4 of the way up towards the groin, right? And you're just with your elbow and not just with your elbow, but with your forearm, you're just giving it pressure there. And then you're just holding there, right? That's all you have to do is just give some pressure and just hold it there. All of these holds you want to do from anywhere from 2 to 5 minutes. The point in that is that your nervous system takes a while to respond to the actual stuff that you're doing. So if you just do it for 30 seconds and don't hold it, chances are that you're not going to get as deep of a change. You don't need to go to 5 minutes, but the whole goal is to do the release and wait until you feel a release of the muscles. Now, it's not gonna all release in one time doing it, but what you will notice is, let's say that you first start doing this release with the elbow or with the foam roller and you realize that the pain is really high. Then you're waiting until the pain starts dropping down, then you know it's working, right? So you will be given the same amount of pressure, but it doesn't feel as painful. Then you know, okay, now I can kind of give it a rest. Now, the next part is getting some blood flow to that area. So right after you do any of those releases that I showed you, what you would want to do is get some blood flow into that area. It's super simple to do that. In order to get blood flow to certain areas, right, you want to do high reps. So you keep the exercise relatively easy. So you could literally sit on the ground like this. I like to put my elbows down just because it's easy to relax. And I'm literally just doing this, right? As I'm doing this,
the blood is going into this area and it's hydrating all the stuff around the knee and the tendons and the tendons and ligaments, and you might notice that you feel like a rush of blood going there. That's completely normal. That's exactly what we want to do. I would suggest doing 2 sets of this, and then maybe you come back later in the day. It is completely normal that the next day you feel sore in this area, like as if you got a deep massage, because that's basically what we're going for, but we just needed to switch the area that you were massaging. If you're realizing that, this is helping a little bit, then start to do it periodically. So I would do it at least once a day, but you can do it more times. But more times is not necessarily better. So you don't want to be doing this 3, 4, 5 times a day because you want your body to heal and recover. I hope that helps you out.